Hi there, I am Dr. Christine Anderson, and I am here to talk to you about actually when you're thinking of having a child and getting ready to have a child, so preconception planning and how you can reduce your risk of having a child with autism during that preconception planning and also during pregnancy. So, this is following up on the last part of our series where I talked about risk factors for autism. And now we're going to talk about what you can actually do if you have some of those risk factors or things you can do to decrease those risk factors. So let's just dive right in. Here I'm reminding you the 8 risk factors we talked about. Now there are other risk factors, but these are the ones that we focused on last time. So we're going to go down and talk about these things. As far as number 1 goes, the being male, the only thing I know that you can do to decrease this risk if you are trying to possibly have a female is there's some old wives' tales about things you can do, but I'm not going to talk about that. We're going to dive into more of the aspect of the age of parents and this concept of biological or pheno age versus chronological age. And when I talk about pheno age, I'm talking about phenotype. And when we talk about phenotype, this is where we're talking about expression of our genes. So our genes are our genotype, and how they express themselves is what we consider our phenotype. And this is all based on epigenetics. So that's the things that you're doing in your life and your lifestyle and your environment that you are in, not only based on what is going on with your genes, but how these environmental factors and lifestyle factors affect how those genes are expressed. So there was a study that looked at epigenetic factors and biomarkers of aging for lifespan and health span. And that I will put a link to that study in the description. And basically what this is based on is something they call DNA-M phenoage. And there are blood tests that you would have done, and you put the results of those blood tests into a type of calculation, and then you would come up with your biological or phenotypical age. And if you want to have that done, I can do that for you. I have a calculator, a system I can put that in. So you just contact me and I can help you out with that and let you know the tests that you need. And I can help you, if you're in the US, I can help you with getting those tests done. I can order them and I can work with people remotely on that. Then there's the real age questionnaires, and there's one at sharecare.com, and this is in relation to looking at a lot of different aspects of like your sleep and your diet and your exercise and your emotional and social aspects. So it's a very extensive questionnaire on that. And you can go to sharecare.com and you have to sign up and fill it out, but they will let you know based on that what your age is. And so I actually did both of these, and they basically came up with the same number, which was very interesting because it's kind of going from 2 different ways. One is looking at blood tests and the other is looking at just sort of questionnaire lifestyle. So I thought it was very interesting. They both came up with that I am about 7 years younger than my chronological age, which is the age based on my birth date. So it's always good when you are younger, your insides are younger than your chronological age. And this is why I say to people, risk factor is there for older parents, but if your biological age is younger than your chronological age, then it means that your body has not aged the same as someone who is your same age. So this really does matter. Now, there's a couple of other things that I think about that really aren't taken into effect. So I may even be younger, hopefully, than these questionnaires and the DNA pheno-age calculator, because it's not taking into consideration things like frequency. And I talk a lot about frequency, and it is super huge because you can do a lot of things in a positive way. But if your frequency of your body is off, it is going to not be able to function as well as it should. And then there's brain and neurologic function. None of these things are really testing how is that communication, that top-down communication from your brain, and how is the nervous system functioning. So these, of course, are a couple of other things I would take into consideration when I am looking at someone and determining their biologic or phenotypic age versus their chronologic age. So just a few things from this DNA and pheno-age study that I'm going to put in the description. A few highlights about certain things that they found that will age people and other things that will help them have a younger biological age. So smoking is huge. That is like the number one thing that ages us. So if you're smoking, then this is something that you're going to want to deal with. A red meat and high fat diet. In the blood tests, if you have a high CRP, this is a measurement of inflammation. High glucose, triglycerides. If you are overweight, if you have a high body mass index, or your waist to hip ratio is bigger, so your waist is bigger than your hips, these are all things that put you more at risk for an older age. Then also is the high systolic blood pressure. That's that first number where the heart is working. Now, conversely, the things that help to keep us younger in the biological age would be a higher education and income, regular exercise, higher fruit, vegetable, and nut intake, and a higher HDL cholesterol. That's what we consider to be our good cholesterol, and the one that is usually affected the most by things like exercise. So these are things that are certainly within our realm to change to help lower the biological age. All right, so supporting a healthy conception and pregnancy, and this has to do with the third risk, which is more about being exposed to things like drugs, either pre-pregnancy or during pregnancy, premature birth and low birth weights, multiple pregnancies and spacing them less than apart, and also being overweight. This is a problem if you are pregnant with the risk factor of having a child with autism. And if you remember, I said these risk factors don't mean that you will have a child with autism. It's just that it is, you can sort of put a tick there. The more of these that you have, the higher your risk. And because of epigenetics and lifestyle, these things can all be changed. So of course, I am a chiropractor. First and foremost, and always, because it's always about the brain, it's always about neurology. So if we look at chiropractic care, I love when patients come in and talk to me about conception planning. I'm thinking about having a child. I want to make sure everything is good so that I can have the best chance of getting pregnant, I can have a good pregnancy, and then a good outcome with a healthy baby and a healthy child. that is the optimal. And if you can do that 2 to 3 years before you actually have a child, that is like the best. Now, I like at least 3 months. So people who come in, especially if they've been trying to get pregnant and are having trouble, um, and like try to, kind of put that off for a few months. But as people are having children later and later, they've got a clock ticking. And so sometimes it's just like, oh, I don't really want to wait that time, but it is so worth it to get your body into balance before you even start to think about getting pregnant. So we want to make sure that best sperm is meeting the best egg. We want to support all the systems that are necessary for conception and pregnancy. So making sure that the uterus is able to do its job, the cervix, and of course all the hormones. We want proper alignment for the baby to develop. So in utero, if that pelvis is not lined up properly, the baby's going to be having a hard time having adequate movement for brain development and nervous system development, and then getting into proper positioning. And if the baby is having trouble getting into proper positioning, that's going to affect if there's any birth interventions to help that baby come out. There's also the aspect of pain elimination for the ability to move, to exercise, which we know is one of the things beneficial for the body and the brain and for your age. So this is something that has a positive effect with chiropractic, as well as stress reduction and positive mental health. And this is where working with stress, which we're going to talk about in a little bit, certainly comes into play. And we're going to talk a little bit more about positive mental health too, because that is another risk factor. So all of these things can be helped with chiropractic, and because I do a lot of integrative care, I'm also looking at diet and other things that come into play. So trying to help prevent things like gestational diabetes, which is another issue that can create a mom being overweight or issues with the baby. Diet and nutrition counseling, and even especially if you're doing preconception, which is great, I can do some detoxification if there's any toxic issues. And then, of course, avoidance of toxins, which can affect the brain development. So the mental health support is important too for trying to decrease risk, because we know parental psychiatric issues is one of the risk factors. So this can certainly be helped with things like chiropractic and exercise and diet and stress management, mind-body techniques such as NET. That is what I do in my office, or things like aroma freedom technique, which uses essential oils. There's other techniques that I don't do but are really great, like EMDR, NLP, and the emotion code. So there's a whole bunch of things out there that can help with this mind-body connection. And then we're going to talk more about brain imbalances, but working with someone who does functional neurology is going to help with this aspect that we know for risk factors, especially with things like schizophrenia, depression, bipolar disorder, and psychosis, and those being possibly due to a brain imbalance in the parent. Again, working with integrative care, so diet affects your mental health. Exercise certainly does. Brain chemistry, are there any imbalances going on there? And certainly toxins that can affect how the brain is functioning. And then with the stress response and management, so I've talked about the stress response evaluation. I've talked about it in earlier episodes for this autism series, but I've gone into in depth. So I'll put a link to that in the description. And also, as a result of doing the stress response evaluation, bio and neurofeedback can be helpful in getting to the brain to be more balanced in its communication. So this is another tool to help with this particular risk factor. And it's not a substitute for mental health services such as psychiatry or counseling or psychology. But it can help because if we can get to the cause of why some of these imbalances are occurring and creating these issues in the brain, then you're going to have an easier time with getting through with help with these things. All right, so family history, and this is sort of where we're talking about epigenetics versus genetics. And we talked about epigenetics early on in this series where lifestyle can cause those genes to turn on and off, affecting the expression, which is that phenotype I talked about at the beginning of this episode. So this is more about what is going on in the life versus what you've been dealt with your genetic structure. And we know that autism tends to run in families, but it's not just a simple thing like, oh, this is inherited from your genes, because we know from one of these studies that the fraternal twins were more apt to have autism than the ones that were identical twins. So this means that it's not just in the genes, it's more about what is going on with the genes once these babies come out. So the lifestyle and also their stress response. So, like I said, I talked about lifestyle in relation to biological age, so you've got some things to do there. And also during my other video episodes, I've talked a lot about lifestyle with optimal health and the 7 facets of health. So I will put that on there, which is the start of my series in optimal health, optimal life, because these things really do make a difference. What you're eating, how you're moving, how you're breathing, the mental health aspect, the social aspect. So all of these things do matter in what's going on with your genes. You don't have to be doomed if you have a certain genetic structure. Now, with the MTHFR gene, we know that this interferes with absorbing folate. And this is involved in the brain development and nervous system development. And so if you know that you have an MTHFR issue going into pregnancy, then you're going to make sure you're taking a supplement, especially a methylated folate supplement, because of this problem with absorption of folate. Now, we know that autism can involve a minimum of 5 to 10 genes. And I'm not saying that it's causative, but they're connected to autism. And here's a list that I have that can be associated with autism. This is not exhaustive, but if you have one of these, then you're going to have like another tick in the risk factor section, and that means you're going to have to do the things epigenetically to make sure that these genes will not have such a great expression. All right, so now we are venturing into this left hemisphere dominance balancing. So I'm going to focus on the left hemisphere because if you go back to my other episodes where I talk about brain imbalances, you are going to see that most of the time parents that have children with autism have a higher functioning left hemisphere than they do a right hemisphere. And I will also put the link to my episode on functional disconnection syndrome, where I go into more depth about what the right brain functions are and the left brain functions. But basically, what we have to do is increase the activity of the right brain to help balance out what is going on in the left brain. So this means that you've got to increase your physical activity, because most people with a dominant left hemisphere are going to be sedentary because they like to do things that are very cerebrally oriented, right? They've got jobs where they're usually at a computer or sitting a lot. You want to strengthen your core. This has to do with the right brain, which is where the core, the gross motor control is one of our first abilities, because we've got to hold ourselves up and then stand. So within the first 2 years of life, we really want this gross motor skill activity to kick in. But the more you're sitting around, your core really diminishes. And if you don't use it, you're going to lose it. So I have a couple of videos on core strength, how you assess it, how you can strengthen your core with 4 basic moves. So I will put a video to that so that you can start working on your core, especially your back core. Then there's sensory stimulation. So we really need to do the proper stimulation for the right hemisphere. And I've got some things written down here where you are going to have light come into your left eye so that it will go to the right hemisphere, because most of our body, the brain function is on the opposite side of the sensory organ. So our eyes are taking in that information. So you can block your right eye so the light goes into the left eye, and the blue light or indigo light in that spectrum is going to stimulate the right brain more than the left brain. So this is just something you can do. And I'm talking about in general. So the better way would be to meet with a functional neurologist that can help figure out what you need specifically, but it doesn't hurt to try some of these things and see what happens with your hemisphere. And you can do that checklist. If you haven't gotten it yet, you can contact me, or you can go on my website and you can do that checklist to see if you're more right or left brain dominant. You can also block your right ear and play right-brained music in your left ear. And you can do some light touch or deep pressure vibration on the left side of your body only. You can put strong odors in the right nostril. This is your olfactory nerve is pretty much the only nerve in the body that goes directly to the same side. And strong odors would be, garlic, onions, essential oils that are more pungent, or like peppermint, eucalyptus, so they're not too sweet. You can use cold or heat just on the left side of your body, so you've got that movement over to the right. You can do some exercises where you're rotating to the left. You can sit in a swivel chair and rotate slowly with your eyes closed to the left, or you can rotate fast if you're okay with that, so that if it makes you dizzy, you don't want to do it. Balancing on your left foot, again, is going to stimulate the right brain. So these are just some of the instances. And again, I can help you figure out which hemisphere. I can help you with the exercises. And I can even do this remotely now that we have the magic of Zoom. So don't think if you're not in my area, there's still some ways I can work with you, or I can help you find somebody in your area. And then, of course, the chiropractic adjustment, which is, especially in the upper neck, can be a super highway sensory stimulation into the brain. Super amazing. And there's also a way to do hemispheric adjusting, where I adjust on the left side of the body so that it's stimulating the right brain. So there's a lot to be done there. All right, let's move on to some other aspects of left hemisphere balancing that you can try in these activities that are really more right-brained activities, like singing, writing a song, improv, where you're not planning out ahead of time and you're just sort of acting, or playing. If you play a musical instrument, you're just sort of jamming on the moment, or just some writing where you're not really thinking about what you're writing. Dancing, you put music on and you're not really thinking, you're just moving your body, like interpretive dance. Creative writing or poetry, pantomiming or charades, we're using big body motions. Mazes, you can make them or do them. Drawing or painting without copying. So you're just drawing whatever is coming into your head, almost like doodling. drawing or painting with your left hand, which hopefully is your non-dominant hand. That's a whole nother topic for a whole nother day. Joining a team sport, usually left hemisphere dominant people only like solo sports. So joining a team sport, a couple of years ago, my husband and I joined a kickball team. So this was definitely something that I don't usually do. I'm usually more of a solo sport person, but it is always great to go out of your comfort zone to keep your brain learning and acting. So you want to do things that are stimulating your creativity without too much planning and too much thinking. So those are just some suggestions. All right, so lowering your stress response. Now, this is a huge one. We touched on a lot last time. Most people we throw the word stress out a lot, and I've done videos on the stress response. Like I said, I will put that in the description, but knowing exactly what it's doing in your body is really important, because then you can do things like biofeedback and neurofeedback to help with balancing it. There's another thing I use for training the brain called a BRAINTAP, and I will put that in the description. And of course, chiropractic, as I said, if you don't have that communication between the brain and your rest of the body cleared out, your things are just never going to work as well. Movement is going to help lower your stress. Deep breathing. I'll put a link to my breathing video. Eliminating toxins. Last month I did a whole series on toxins and detoxification. I've talked about household and body care products, so I'll put links to all of that in the description. And I have talked about EMFs and interviewed experts on EMFs. So this is another big thing, because we are now inundated 24/7 with electromagnetic frequencies from Wi-Fi and cell towers, and now 5G is coming into play. And a lot of these things, we don't really know the long-term effects, but there is one thing we do know: it does affect our sleep and our repair and rejuvenating of our system. And I interviewed, along with my daughter, Dr. Carlos Ritter, who actually did studies on what EMF does to us in sleep. So if there's one thing that you need to do, is have your bedroom be a sanctuary where you get all electronics out and you just have as much as possible, turn your Wi-Fi off, unplug everything in the room, have it completely dark, so that you can have a chance to restore and rejuvenate. And there's some other things you can do too with frequency. I use some crystals. I also use my SOLEX AO scanner here and program it for things like sleep well or sedative. So it's sending my brain frequencies to really kind of download. And you can also use BRAINTAP at night. There's so many things to do to get your body in a rest state so that it can rejuvenate, repair, renew. If you're not doing that, and if you're not getting 7 to 8 hours of sleep a night, that cannot happen, and is going to create imbalances in the brain and increase that stress response that we talked about last time. We've got social, emotional, and mental support. Of course, we need to make sure that we're supporting our mind body on all levels. So those mind body techniques I talked about, and also consider avoiding negative people and situations. I have not watched mainstream media news since 9/11. So, that's like 20 years ago, because it was so negative. I could feel it affecting my mental state. Negative people will affect those energy vampires. So sometimes you have to kind of back away from those situations so that you're not getting your body into a chronic state of stress. keeping your frequency high. As I said, really frequency is everything. Everything is frequency. I'm going to put links to all those talks I did about frequency because it is really, really important. And again, on my AO scanner here, I've got stress-free that I can play on here, peace, calm, and tranquility, energy clearing. There's so many things on here that I can use to help support lowering this stress response. And then to support everything else, maybe using some supplements, homeopathy, herbs, flower remedies, essential oils, this type of thing. And I'll put a link in the description to my FullScript account where I create protocols that you can go in and order from at 10% off. So you can go take a look at that. All right, balancing your immune system. So here we are at the last risk factor that we're looking at. And again, we're going to focus on left brain dominance or right brain weakness when we talk about this. If you have the opposite scenario, then you most likely are not at risk for having a child with autism. So this is why I'm really focusing on this left brain dominance, right brain weakness. So especially if you are having issues like allergies, asthma, eczema, autoimmune issues, chronic inflammation, then you most likely have this imbalance going on. Now, you can do a TH1, TH2 challenge, or you can test for it with your blood. It can be a little bit expensive. There's a challenge you can do with supplements to see if your symptoms get better or worse based on what's in those supplements. So I can help you with that. And a lot of times, if you've got these imbalances because of what's going on with the immune system, it either might have started in your gut, or as a result of the imbalances, then it creates problems in the gut, and then it becomes a vicious circle. So oftentimes there might be some need for gut repair. So again, I am able to help with all these things remotely, either with testing, I use a lab called SOLEX Labs, or taking some of the supplements and seeing if it helps you. And again, you can just go to my FullScript account for those protocols that I've created and get 10% off. So if you know that you are left brain dominant and you want to help balance your TH2, you want that seesaw of the TH2 is too low, you want to bring it up and create an anti-inflammatory response, I've listed some things here that can be helpful, like green tea extract, grapeseed extract, lycopene, pine bark, or pycnogenol, resveratrol. Those are some things that may be helpful. But you, on the same account, because your TH2 is too low and the TH1 is too high, and that's inflammatory, you may also want to avoid things like astragalus, maitake mushroom, echinacea, lemon balm, these types of things. And then also consider looking at your vitamin A, D, and E levels, especially D, and again, probiotics to help with your gut. So here's just some guidelines for you, but obviously it's better to work with someone who's doing integrative care or integrative medicine so that you can be the most specific, but here's somewhere to start if you want to try looking at that. All right. Wow, we made it. So to reach me, you can contact me through my website, losangeles-chiropractor.com. And I've listed here just a few things that I can help you with in this preconception and pregnancy planning. Obviously, if you are local, I am here for you for the cranial sacral and the chiropractic care. But there is a lot of things I can do remotely or local. So you can certainly have a look there. A lot of the testing can be done remotely, but you usually have to be in the USA for this because of the test kits. But there are some other things I can do worldwide. So if you want more info, you can contact me. And I have a lot of these things on my YouTube channel where I do videos talking about some of these things. So if you can't find it, just let me know. But I'll try to put as many in the description as possible. All right, so there's some things you can do to help with reducing your risk of having a child with autism and really, in general, to be healthier. That's what this is about. The healthier you are and the more balanced your nervous system is, the better it is for you, and then the better it's going to be for your baby no matter what. Have a great week. I've decided to extend this series, so next week I'm going to be talking about red flags for autism, so that when you have your child, you can be looking for certain things or some certain things that if you see, you can bring to the attention of, well, you can bring it to the attention of your medical pediatrician, but more likely find a chiropractic pediatrician to work with, especially one who's trained in neurology. All right, bye until next time.